Hello everyone, welcome to Team TDF Wellbeing Webinar. My name is Irena. I am one of the practitioners at the TDF. I am an acupuncturist, and today I am going to show you an acupressure method, acupressure points that can help you fight, deal, alleviate insomnia. Remember, all of your videos are switched off and I can hear you as well, so there's no live contact between us during the webinar. Make yourself comfortable, have a glass of water if you want, just sit as comfortably as you can, switch off your phone, I'm into silent mode. Try to just relax and be with me for the coming half an hour. Do close your eyes if you feel like doing so. The guided session will take about 25 minutes, and after we've gone through the program for insomnia, I will repeat what we've done. I will repeat the points, and that should last for around half an hour. So we will be done by 12:30. Please remember to participate according to your own ability. Acupressure has no real side effect. It can cause bruises where you press, or a bit of hemorrhages inside, but I mean within your body. But I will ask you to use pressure that you feel comfortable with. If you have any questions after the session or want to get in touch, email us at therapysupport@tdf.org.uk. So we'll start right into acupressure points, and I will explain the part of the theory behind it while we practice. So, when insomnia occurs, it means on the level of the channel theory that the yin and yang, yin qi and yang qi, the energy does not flow as it's supposed to. The connection is somehow broken. So the first three double points, because they are located on both sides of our body, the first 3 points will help us reconnect this flow of energy. They are first 2 are located on around the malleolus, lateral and medial. I'll stand up just to show you. So to find them, here is the malleolus, medial and lateral. You just slide your fingers under them. On the lateral side, there is a point called bladder 62. On the medial side, there is a point called kidney 6. Once more, find the lateral and medial malleolus and then just slide below it. And you will find depression. Please continue pressing these points. I'm extremely uncomfortable if I wanted to be pressing them along with you so you can see, but please press these points. I will set timer. Just give me a second. Okay. we are going to press them simultaneously because we can. So it's just the easiest way to do this, and it will take less time. We can, if we can, we always can use more than one acupressure point to press at once. So previously I always was showing you how to press one point after the other. If you find a way to press them simultaneously, please go ahead. It's absolutely fine. So try to press. You may press and lift, like press and lift, press and lift, press and lift, or use circular motion to do so. Just try to stimulate the points as much as you can. So regarding the pressure used, it can be, when you do it to yourself, just feel what you are comfortable with. Some of the points may be sensitive, and just use the force you are going to use. Just make sure it's comfortable with you. It's slightly on the side that may be painful, but don't make it too painful. Just a bit more than is really comfortable, slightly more, just to wake up the point, that's to stimulate it. Please continue pressing the points, bladder 62 and kidney 6. They will help reconnect the two types of energy, as I said before, the yin qi and yang qi. There is the whole theory about yin and yang energy, and it's a philosophical term as well as connected and used in health. So now we are going to move to the other foot. So find the lateral and medial malleolus and just slide under there. Just slide, if you can see well, medial, lateral, and just slide below. Please continue pressing that point. So the point, bladder 62, located on the lateral side of the malleolus. This is on the body, below the malleolus. I'm sorry, I was just moving. It's extremely uncomfortable for me, so I'm sorry, I need to catch my breath. And please make sure you are comfortable. Now when I sit, but then you can't see my feet, I'm comfortable and it's fine with me. So the bladder 62 point is the point that activates the whole channel. And the channel starts here between the eyes and goes over the head to the back. Here it divides into two, like 4 fingers need to show, 2 lines, and it goes here and here and comes together on below the knee, and then goes down and ends at the small thumb. So this point activates the whole channel and alleviates pain along the meridian. And this is a well-known point for problems with arms and neck, stiff neck, and it's very good for lower back pain. So we are moving to the next pair of points. Next pair is located next to the inner canthus of the eye, slightly above it and slightly to the nose. So slightly above and to the nose. Inner canthus, slightly above and to the nose. And just let's press these points. These 2 points are very good for any eye problems you may have, like pain, like color blindness, night blindness, optic nerve atrophy, beginning of cataract in early stages. Just press swelling, vision, not clear vision. Just breathe, press these points. And of course, besides being an excellent local point for eye disorders, it helps connect the energy, the yang and yin energy. So it helps us cure insomnia. So these first 3 points that we worked so far are bladder 62, kidney 6, and bladder 1. See, we use 2 points on the same meridian, bladder meridian. Here is bladder 1, and we use the other one on our feet. So I started talking about the pressure. So use the pressure you feel comfortable with, and you feel that it actually does something to your body. You just feel it. But if you do acupressure to children, the pressure you use is very light. It's like if you were checking whether the cake is baked, or if you were finger painting. So these 3 points help us reconnect the energies, helps us make the flow through our body, make the energy flow easily through our body. Next 3 points that I am going to show, double points, 3 double points, are used for insomnia, for any type of insomnia, because obviously there are lots of different types, different reasons why somebody suffers from insomnia. So without getting into the main problem, the main cause, we can use the next 3 points as well. The only thing I would strongly advise you to check on you is how much it affects you. What I mean by that, lots of my clients, and not all of them, when I do acupuncture on them for insomnia, on these 3 points, they ask me when they come next time not to do that because it can make you sleepy throughout the day. So imagine you have an appointment at 10 a.m. and it works and it makes you feel sleepy for the rest of the day. So with these points, I do advise you to use them right before you go to bed, or half an hour before you go to bed, somewhere around your bed, when you are home, when you can relax, when you can rest. So the first point is a special point. Its location may be a bit tricky to explain. So we've learned a point called gallbladder 20. It's located and at the origin of sternocleidomastoid muscle, this muscle, right under the skull, and between the origin of the deltoid muscle. Sorry, the trapezius muscles, the big muscle at the upper back. So it's located between them. When you rotate head, you can feel this point. So find this point, and now find the depression right under your ear. There is this lovely depression, and the point we are looking for lies just between the two. So you find the point between two big muscles that originate at the skull. Find the depression right under the ear, and the point is between them. Once you have one side of the point, you can press simultaneously second one. So the second one. Here is the origin of the deltoid muscle, and here is the sternocleidomastoid muscle right under the skull, and then the depression under the ear, and here we are. These points are called anmien. This point is called anmien. This is a special point, and it helps with insomnia. It is a special point. It means that it doesn't lie on a meridian. It's just a point. There's no channel behind it. So these points help us sleep better. You may keep on pressing them, or press and lift, press and lift, press and lift, or do circular motions. Whatever you feel is good for you, just continue pressing these points. So the first 3 points you can press wherever you can, whenever you can. While watching TV, for example, you can sit on the couch and press points on both sides of medial malleolus. You can press this point anytime. Just remember to do so. And these points, it's better than the 3 points that we are doing now. It's better to do right before bed. So the next point is located here. It is heart 7. It's on the wrist. This is the bone. You can feel it. It's right under it, and on the radial side of the tendon here. So to the middle line of the wrist. So this point is here. Heart 7. It helps calm the mind. Of course, before starting any treatment, please talk to your GP. Make sure that you have the right diagnosis, because often when we suffer from lack of sleep, it is not necessarily insomnia. What I mean by that, sometimes it's caused by different medical conditions, like asthma, like itching of the skin. You just can't sleep, pain. And it's not insomnia, it's like side effect of having a different medical condition. What else can happen is jet lag. It's too hot, too cold in the room. It's too noisy. We had an argument before going to bed. We are upset, emotionally upset about something. So it's not necessarily insomnia. So it's important to have the right diagnosis about the problem. Continue on pressing. I like to to kind of massage the point, not just press, but massage. And I'm not sure if you can see, I'm using quite a force here, but that's what I feel comfortable doing. So now we go to the second hand. Again, on the wrist, here is the pisiform bone. It's under there, and to the radial side, to the midline of the tendon here. Yeah, here's the tendon. So just let's press this point. Often we suffer from lack of sleep because we have small children and they just wake us up. And to deal with this problem is to find a way, teach the kids to sleep throughout the night, to sleep in their own beds, not to wander, not to want to drink. So it's kind of to train them or help them, because children can suffer from insomnia as well. Please continue pressing. So in general, what I mean when I say insomnia, it can be it can happen that client has problem falling asleep, or wakes up during the night a lot, or wakes up very early, or the sleep is restless, or dream disturbed. So in Chinese medicine, we have explanations for why it happens, and we can help using acupressure, acupuncture. The organs, according to Chinese medicine, that are involved are the heart, the lungs, and the kidneys, and our digestive system. In insomnia in Chinese medicine, it can be of two natures, like there's excess of something or there's deficiency of something. So, for example, if our digestion tract, I will get back to it, we will move to the last point of the points that make us sleep well. The last point is located in the front of our body. So this is the malleolus, medial malleolus. When we put our hand above it, above the medial malleolus, and the width of our fingers here show us the position of the next point, which is spleen 6. It's located right behind tibia. You can feel the bone there, so it's located right behind it. Not on the bone, but right behind, when you could just slide from on the bone and just slide into it. So hand width above the medial malleolus, and you can slide on the bone. It's located here. You may press and lift, press and lift, press and lift. Do circular motions. I'm still pressing this point. Please continue doing so. I'll try to find a better way of positioning myself so you can see what I'm doing. Or maybe this way, yeah, here. So this point is here. Medial malleolus, hand width above it, and behind the bone. One more thing about this point: if you are pregnant, please don't use it. Acupuncturists can ascertain your condition and may use this point, but in general, it's contraindicated in pregnancy. Only a specialist can decide on using this point. So now we go to the other side. So medial malleolus, yeah, you can see it here. Hand width above it, and just slide on the bone, just behind the bone. It's here. Press and lift. If you are pregnant, please don't use this point. Press and lift. Press and lift. Press and lift. So I talked a bit about the organs involved in insomnia, the disbalances that can appear in those organs and cause insomnia. So please continue pressing spleen 6, the point I've just showed you. And let me explain the next thing. I'm going to show you how to massage your back. So there are organs involved in insomnia, and each client have different story. There's different root cause of the problem, is in different condition, in different state, in different age, which is important as well, because for example, older people don't need that much sleep as younger people. So to help you deal with your problem more in a more tailored way to your specific condition, I will show you, please continue pressing this point, I will show you a type of massage that please ask someone to do on your back, and this way you will activate all the points on the bladder meridian here, these two lines and these two lines. So between the shoulder blades, when your arms are located like this, so it's between your shoulder blades, just massage this point. Start massaging. Ask someone to massage it. The way to massage it is, let me show you on my legs, like here. So you just grab the blood as much if you can of the skin, the tissues, and just roll it, yeah? And do that on your back, like roll it. It will activate all the organs in the body, and it will help you strengthen them or balance them, whatever they will need. This little massage will help. Please ask somebody to do that for you. We are running out of time, so let me just remind you which points we used. So first 3 points, first two located on the both sides of malleolus. Just slide your fingers down and press them. And here, bladder 1, just press point, just slightly above and to the nose side of the inner canthus of the eye. So these 2 points do whenever you like. And the next 3 points, see how your body reacts. So the first one is located between gallbladder 20, that is located between the origins of sternocleidomastoid muscle and trapezius muscles, and the depression under right behind the ear. So it's here, Anmien, special point for sleep problems. Heart 7, located on the wrist under the pisiform and to the middle line of the tendon here. Heart 7 on both sides. And the last point is spleen 6, which is located on the medial side of the leg, medial malleolus. Position your hand like this, and it's located here, slight behind the bone, behind the tibia. I hope you enjoyed today's session. Thank you for attending. We rely on donations, so please give what you can. I hope you enjoyed it. Enjoy your weekend, and I hope everyone will sleep well tonight. Goodbye.